When it comes to the management of polycystic ovarian syndrome or PCOS, there's actually availability of a wide array of therapeutic interventions that I think are very poorly discussed or not discussed at all for patients that are dealing with this condition. And I want to share more information on something called fertility acupuncture. So there was a wonderful review that was published this year that looked at all the studies to date, specifically on acupuncture and how it can help with polycystic ovarian syndrome. Now, when we talk about acupuncture, sometimes patients assume that all acupuncture is the same. And what I want to clarify as well is in traditional Chinese medicine, acupuncture is synonymous with medicine. It is medicine. So when they look at using acupuncture for particular conditions, there are whole textbooks and studies, hundreds of studies dedicated to those particular conditions. So we have differences in the type of acupuncture. So there's musculoskeletal acupuncture, there's reproductive acupuncture, obstetric and gynecological acupuncture, acupuncture for gastrointestinal diseases, acupuncture for neurological diseases. So acupuncture is not kind of like a one blanket fits all. There's actually a wide variety with over 500 acupuncture points available. What protocols, what timing, what types of different acupuncture, is it dry needling or something called electrostim or laser acupuncture? What has actually been shown to be clinically effective in actual studies? So that's really what we want to focus our time and efforts on if we're going to invest our time and money for a specific intervention. We don't want to just use, the same acupuncture protocols that someone does for gastric reflux disease and then apply them for polycystic ovarian syndrome. So the specific protocols that have been studied for polycystic ovarian syndrome target a lot of the major underlying issues that are at the root cause and root problem of polycystic ovarian syndrome. So number one, cycle irregularity. This is something that's not mandatory to have in order to diagnose PCOS. It can occur with some patients have PCOS. And we see that using fertility acupuncture can actually increase spontaneous ovulation rates and may help to regulate how many days of gaps you're having between cycles. So instead of having 45, 60, 90, 120, 150, 180 plus days in between periods, trying to normalize that into more healthy and normal intervals. And that is an obvious win for patients with polycystic ovarian syndrome because it provides a dramatic increase in the opportunities and windows for conception, ovulation, and potentially, hopefully, fertilization if you're trying to conceive. So that is number one. And we see that polycystic ovarian syndrome can also help with a lot of the symptoms of things like hirsutism, so increased hair growth that can occur on the upper lip, jaw, abdomen, other parts of the body there. And this is a result of increased androgens or hormones like DHEAs or testosterone. So we see the fertility acupuncture protocols applied for PCOS have actually been shown to reduce the serum levels of those androgens and testosterone in particular. So lowering those androgens is not only important for the symptoms we just discussed, but actually helps with the cycle regularity as well. So having elevated androgens can affect negatively how often you ovulate. And a third thing that testosterone can unfortunately negatively affect when it's elevated in PCOS is actually the risk of having lower egg quality. So with PCOS, sometimes we have an abundance of follicles or eggs, but they tend to be lower quality. And we see that having elevated testosterone is one of the mechanisms that actually reduces the quality or integrity of those follicles, unfortunately. So bringing down the testosterone and DHEAS levels to normal ranges with PCOS can actually be quite beneficial in supporting egg quality as well. And we see that another underlying mechanisms that can be present in some patients with PCOS is what we call metabolic disorder or insulin resistance in particular, where the body's producing way too much insulin compared to what it normally should be. And that insulin can actually interact with the ovary and again affect increased testosterone production and contribute to irregular cycles. So a lot of these underlying issues we see, they're not really they don't necessarily occur on their own. That's why we see all these symptoms can sometimes occur together because they actually increase the likelihood of the other symptoms presenting. So we see that they all tie together. So elevated androgens can affect cycle regularity, which can affect inflammation, which can affect your likelihood of having insulin resistance, which can then affect, again, the testosterone, androgens going up. and all those affect the cycle regularity there as well. So we see the fertility acupuncture seems to actually improve insulin sensitivity. These newer protocols that have been studied, they help to reduce the elevated insulin levels and help with that metabolic health, and they seem to help treat and then normalize certain lipids as well, so cholesterol levels that can go up in patients that have polycystic ovarian syndrome. So how do these incredible things happen with something, as simple as acupuncture? So they've actually helped to study what are the underlying mechanisms that acupuncture actually has. So one of the things we see is when patients get regular fertility acupuncture, there seems to be an increase in the activity of something called P450 aromatase. This is an enzyme that basically helps to convert testosterone to estrogen. So when we have increased expression and activity of the P450 aromatase enzyme, we're trying to basically convert the high testosterone androgens into estrogen, and that's what they hypothesize is contributing to the lowering effect for testosterone with polycystic ovarian syndrome when you're doing the fertility acupuncture protocols that they've studied. A second change that we see at the physiological level is an increase in something called beta endorphins. This can occur in the ovary, at the level of the ovary, and we also see in the central nervous system. This increase in beta endorphins can actually trigger changes in the expression of hormones like FSH and LH, which downstream will then impact production of things like estrogen and progesterone and can contribute to cycle regularity and ovulation as well. In addition to all these, we see that the fertility acupuncture protocols seem to reduce a lot of that chronic low-grade inflammation that can be present in some patients with polycystic ovarian syndrome. So they see suppression in levels of things like interleukin-6, TNF-alpha, which basically would contribute to increased inflammation in the body there as well. So these are some of the underlying mechanisms by which we see fertility acupuncture may be helping patients that have polycystic ovarian syndrome and are trying to conceive or just trying to manage the symptoms there. And so, we always look at acupuncture as an adjunctive treatment option. I would usually not recommend it to someone as a sole treatment, but when you're trying to manage PCOS with additional evidence-based approaches, acupuncture, I find especially early on when we're going from like very irregular cycles, quite severe symptoms, can really help to just train and develop kind of a hormonal rhythm and a bit of inertia for that ovulatory cycle. So when things are better managed, then we start to take the acupuncture out, and then patients can manage it with other methods. So it can be kind of like a really good, I think of them like training wheels for the cycle in the first few months there, where we're trying to get healthier ovulation and trying to bring down some of the testosterone or androgen levels there.